If people knew what it takes to get vaccines, what it actually costs to make vaccines available, they will understand why government decide to make that free. If it's to be sold to them, probably they will not be able to afford it. The cost of moving vaccine is quite much. For Sokoto State, the vaccine delivery process has been quite successful. For over a long period of time, we had a very good understanding and engagement with eHealth Africa, who has been delivering vaccines from our state cold store to our Apex facilities and the LGA cold stores. This relationship actually started since December 2016 and has been going on smoothly. The delivery initially was done bi-weekly, that's every 2 weeks. Then later it was expanded to cover a month period. And that's because as we move on, the cold chain capacity was being increased in other health facilities. So for that, the facilities are able to hold 1 month of stock of vaccines. My name is Pharmacist Murtala Bello. I'm currently the Director of Pharmaceutical Services, and that is Sokoto State Primary Health Care Development Agency. I'm the Chairman of the State Logistics Working Group, and we are responsible for ensuring that vaccines get to our health facilities. We're also responsible to make sure that the integrity of the vaccines are preserved from storage through transportation to use by our clients. So anything that relates to health commodities, storage, distribution, rational use, and other things, it's us.
My role as a state cold chain officer is managing vaccine, keeping vaccines safe, and also try to distribute vaccine from state cold store to LGA and also to the health facilities for effective utilization.
The most difficult part is the technical work in terms of the preparation of the ice packs and also packaging of the vaccines, because you have to be very careful so that you won't make any mistake regarding the calculations of the actual doses that you have to issue to those facilities. Sometimes we'll come to the work since in the morning and we will not leave till maybe 12. Sometimes we have to even sleep at the state store. It's one of the most difficult tasks I've encountered.
The local government cold chain officers also receive some token amount as a support for them to be able to move these vaccines to areas of need when they are likely stock out.
So usually all our health facility has their own vaccine. If they have one or two antigens has nearly finished, they wish to call me, then we rush to give them the vaccine urgently.
The most difficult one is this restocking of health facilities, because it's something you don't plan. They will just call you anytime that we don't have this, we don't have that, and they will need your attention immediately. You have to stop whatever it is you are doing and start preparation to transport the vaccine to the health facility.
At the end of every year, we sit down and review the delivery process and see how much eHealth Africa has performed. Generally, it has been successful because most of the planned deliveries have also been actually done through the years, and I'm sure that's the reason why we have continued to engage eHealth Africa year after year up to this moment. I know that our stock out of vaccines has reduced drastically over the years, and then of course has a lot to do with eHealth Africa making the deliveries and ensuring that the facilities who are receiving these vaccines also are mentored to know when and how to raise alarms when they are running out of stock of this vaccine. So I think in summary I can say it has really been successful.
The vaccine delivery, I can say they are doing a very good job because they've never missed their dates unless for some reasons they cannot avoid.
It's about 6 to 7 months now. All vaccine is intact. We don't have any shortage of vaccine.
Gaskiya ba ta samu don kaga normally duk ƙarshen wata EHL idan su haka kawo magani to dama suna kawo magani based on the calculating din sun kai na zai iya kai musu wata to idan har bai kai ba kaga akwai LGA bufa wanda za su yi requesting duk abin da ba su da sai a rika managing din su before ending month sai su zo amma ba wani issue.
If you see stock out in the facilities, is either we have actually shortage of these vaccines right from the supply from the zonal cold store in Kano or either from the national. Most of the time that's the reason. But not because the vaccines are available in our cold store and they are not delivered to the Apex facilities or the LGA cold stores.
Yau muna yin harkar immunization, muna yin RI da kuma CMAM. Yau. Gaskiya ana samun mutane sosai. Ana samun in ma ba mu yi da yawa ba irin za a samu 10 wani abu amma yau gaskiya mun samu kusan mutum fiye da insha Allah 20 mu.
Sokoto is one of the states that have the lowest figures in terms of immunization coverage. Though there has been a lot of improvement over the years, it's a work in progress. Many stakeholders are coming together using different kind of methods to ensure that the demand for this immunization is increased. But I will not say it's the supply because you hardly visit any of our health facilities and see stock outs basically because of the deliveries.
Wallahi ni fata na Sokoto ta hi kowace state a Nigeria datan mu ta hi ta kowa ya zan muna samun vaccination yaran mu su samu lahiya shan inna yaban Nigeria su measles yellow fever da sauransu yanda sauran kasashe da suka ci gaba mu ma ci gaban mu ya kai wannan ya zama mun zama safe ba mu da wasu matsaloli sai dan abin da ba a rasa ba.
We are really grateful because without eHealth, then we cannot have a good delivery of vaccine in our facility and in our LGA. And we all know that vaccine need to be kept in a potent manner. And without eHealth, we will not have such kind of potent vaccine to be delivered through the state and to the LGA and down to the health facilities.